devastating. Boris snowed under as UK scene is accident waiting to happen while the NHS is crumbling. Boris Johnson warned anyone who believes the battle with COVID is over is profoundly wrong as he urged Britons to prepare for a chaotic month ahead. After assessing the situation with senior ministers this morning, he said he was putting the NHS on a war footing but would not be introducing further legal restrictions. The Prime Minister backed sticking with Plan B measures to ride out the massive wave of Omicron cases. The Prime Minister addressed the nation after a dramatic surge in case numbers over the Christmas holidays that has seen daily infections top 200,000. More than 1 million Britons are currently in isolation after testing positive in the past week, and hospitalizations have ramped up over the festive period too. More than 1,000 people have been admitted to hospital every day since December 19. However, the total number of people on NHS wards with COVID currently stands at over 14,000, far lower than the peak 39,254 in January 2021. Mr. Johnson said this evening, "We have a chance to ride out this Omicron wave without shutting down our businesses once again. We can keep our schools and businesses open and find a way to live with this virus." While sticking to his guns on new restrictions, he warned of tumultuous weeks ahead as the UK battles the Omicron variant and said there would likely be severe disruption to services. He told the nation, "Our United Kingdom is in the midst of the fastest growth in COVID cases that we've ever known. Previous waves of the pandemic didn't have a single day with more than 100,000 new cases reported. One day last week we had 200,000 people test positive. And the latest figure today is another 218,000, though that includes some delayed reports. So anyone who thinks our battle with COVID is over, I'm afraid is profoundly wrong. This is a moment for the utmost caution." A number of hospital trusts have warned they risk being overwhelmed due to a rise in new admissions and staff shortages related to the virus. In the NHS, 110,000 staff were off sick on New Year's Eve with almost 50,000 cases due to COVID. Matthew Taylor, Chief Executive of the NHS Confederation, said this morning that the staffing situation in hospitals is almost impossible as leaders try to manage their resources. He said that, for many, the most pressing element of all is the number of staff who are absent due to COVID. Meanwhile, Chris Hopson, Chief Executive of NHS Providers, said at least half a dozen NHS hospitals have declared a critical incident as they try to respond to COVID. This evening Mr. Johnson unveiled his new plan to help keep the country running as it fights through the latest wave of infections. There is no escaping the fact that some services will be disrupted by staff absences, but we have been working through Christmas to prepare for this wherever possible, he said. The government is acting to protect critical national services, keep supply chains open, and fortify our NHS to withstand the pressures ahead. We've identified 100,000 critical workers, in areas from food processing to transport to our border force, and from 10 January we'll be rolling out lateral flow testing for all these workers, available on every working day. We'll be sending testing kits directly to these organizations and liaising with them on the logistics. Discussing the current Omicron outbreak, Professor Ferguson, nicknamed Professor Lockdown for his grim modelling that spooked ministers into introducing draconian curbs last spring, said the variant had not had much time to infect pupils before schools shut for the Christmas break, and a rise in cases is now expected. We expect to now see quite high infection levels, of mild infection I should emphasize, in school-aged children. He added that the good news about Omicron is that it is certainly less severe than previous variants of COVID and that has helped keep hospital numbers down compared with previous peaks. And then the vaccines, as we always expected they would, are holding up against severe disease and against severe outcomes well. That doesn't mean it's not going to be as the Prime Minister said, a difficult few weeks for the NHS. Ministers have vowed to keep schools open this term, saying children's education has already suffered enough to protect others. Education has already